I'm going to speak to you today about my use of video in healthcare. When my slides come up. Don't start the timer just yet. I'm a rheumatologist. I work in full-time private practice in Galway in the west of Ireland. And I run a busy practice. I see maybe about 3,500 patient appointments a year. In the ideal world, my patients would know as much about their disease as I do. I do my very best in the clinic to try and educate them. And even on a good day, when I tell them everything that I think they need to know, sometimes by the time they've got as far as their car or on the way home, they've forgotten a lot of it, or have questions that they think about on the way home in the car that they meant to ask me. So I've been using video over the last 18 months to try as an adjunct to what I do in the clinic to help keep my patients up to speed, educated and happy. I started using YouTube. I like YouTube. It's fairly easy to use. It's free. Although a doctor in the west of Ireland is unlikely to produce an arthritis video that's going to go viral, you have an instant audience with on the biggest video platform in the world. But of course, there's no such thing as a free lunch. Google is based on ads. And sometimes an ad could appear on top of your video that you have no control over. And also, your video tends to be lumped in with a whole load of other stuff. So for example, on the one hand, I might be trying to reassure patients about taking a drug like methotrexate for arthritis, and all they've got to do is look sideways and click on another link to see somebody else talking about the horrors of a drug like methotrexate. So it's difficult to get my message out. So I started using a platform called ClearMD. Anybody who was at the startup pitch yesterday would have heard CEO John Brownlee speaking about it. I like it. It's a video platform for specialists like me to help communicate healthcare-related information to their patients. It's easy to use. I record all of my videos using an iPhone, a little microphone, and on a green screen.
Methotrexate
Here's
is
one
one
of
of
them.
the most commonly used drugs in the treatment of rheumatoid arthritis and psoriatic arthritis. The reason it's one of the most commonly used is because it's been around for a long time. It works for most people who go on it, and also the risk of serious side effects is relatively low.
So you get the general idea. So for example, for each drug that I would prescribe to a patient, or for patients with early onset arthritis, I prepare effectively what is an album of, if you like, individual singles or songs, which have got specific healthcare-related information based on questions that I am asked all day, every day at the clinic. So I will use what's called a vidscription, which is this collection of short videos. And for a drug like methotrexate, I've prepared 12 short videos. They're 30, 40 seconds. They're not scripted. It's just me speaking to patients exactly as I would in the clinic. So typically, we will email a link to that series of videos to a patient in the clinic. 3/4 of my patients have internet access. For those who don't, we can give them a little pad where I can tick off a prescription like this. And of the third of patients who don't have internet access, 3/4 of those patients in my clinic have a relative. So they can go online and look at this stuff. I also have it on the front of my website. I promote it on Facebook and on Twitter as well. So using the software, I get a fair sense of the degree of engagement, how long the patients will watch the individual videos for. And for example, if you look at this one here, you can see that amongst the sort of disease-related videos, fatigue and rheumatoid arthritis is a very common problem and commonly watched. And for a lot of hits in Ireland for can I drink alcohol on methotrexate as well. So in total, I produced 83 videos. At this stage, I've got quick enough that I can knock out, 12 or 15 videos in an hour with the help of my nurse Trish, who helps run the camera for me. I've grouped these together in 12 different vidscriptions, We've got about 5,000 plays on these, and the mean engagement is about 86%. I think that's pretty good. So this is a map of my fatigue and arthritis video. You can see there's a fairly broad spread of where people watch it, with a concentration around Ireland and England. If we were to zoom in closer into Ireland, you'd see that a lot of those hits probably relate to my mother watching me online. So it's got a fairly broad reach.
Hi John, it was nice to meet you today. I know you had some concerns about the methotrexate medications that are recommended. So what I've done is I've prepared some short video question and answer clips which should address most of those concerns. I'd be very grateful if you could have a look at them. And if you have any queries after that, you could probably email me or even ring our specialist nurse Trish. The other thing you need to remember is to get your blood test performed at your GP's in a month's time, and I've written to your GP to explain what blood tests need to be done. And also don't forget to get the flu vaccine every year while you're on methotrexate. Look forward to seeing you next month.
So this is a platform called vSnap, which allows me to record sort of personalised video messages for patients. At the moment, this isn't designed for health. There's a new health startup in Ireland called HealthSnap, which have licensed this technology, who you're hearing a little bit more about, who intend to make this sort of HIPAA compliant for use across a number of different continents and so on. But it's slightly different to ClearMD. ClearMD is a sort of if you like, a generic message. This is much more specific and geared, but it allows you to send a video message to a patient, attach a link to whatever you want to add a link to. So for example, a PDF file or a link to a website, or in this instance, some ClearMD videos. So a few quick tips for those of you who are interested in taking the plunge to making your own videos. The first is, I think probably, particularly for this kind of informational video, keep them short. You know, if you look at the engagement here in the first, if you keep it under a minute, you're going to get 70 to 80% of people watching the video all the way through. But if you look up to sort of 4 or 5 minutes, it drops down to sort of 50 or 60%. I sourced a lot of the questions for these videos on Practice Facebook page and on Twitter, and I asked patients what sort of things did they need answers for. For the most part, I kind of guessed it anyway, because they asked me all the time in the clinic. But what I quite often do is, during the clinic, sit down and scribble out questions that patients ask me as I go along. Sometimes I do a little bit of brainstorming on my own. This is a kind of mind map software, which allows me to map out the videos that I use. Also, although you want a sort of a rough idea what you're going to say, I suggest don't use a script at all, and keep it nice and fresh and spontaneous. It takes a little bit of practice before you get confident enough in front of a camera to do that. Ideally, record the video with somebody else in front of the camera. I think it's nice to talk to somebody rather than speaking directly to a camera or an iPhone on your own in a room. And don't be afraid to make a fool of yourself. That's my nurse Trish now.
Okay, one last go. Right.
So, thank you very much.